Hi, my name is Edward Danda, and I have a doctorate in clinical psychology. I've been working in the field for over 8 years. Part of my training and experience comes from working in psychiatric hospitals for a couple of years and working for federal prisons, and currently working for a maximum security prison, and coincidentally, a psychiatric unit within that maximum security prison too. This video is for educational purposes only. It's not considered to be therapy at all. The reason why I'm making this video is that I thought and I felt that there's a need to point this message out to the world, just to encourage people to reach out for help in whatever way that may seem needed. I would strongly encourage you to don't. I try not to say don't, but don't let yourself get shy from reaching out to help. I understand it can be difficult sometimes and challenging, and this is what I'm going to be talking about. Some of the barriers that I've noticed from my work that gets in the way of people, and hopefully by sharing this video, people maybe feel more comfortable and encouraged to reach out. By the way, I'm aware that I'm probably not going to touch base on every little thing. I wish I had everybody's mind in my own mind, but I'm only one person, okay? So I'm just going to do my best. This whole video was not prepared. I'm just riffing it. So one of the most common misconceptions that I hear from people is, oh, I'm concerned about getting a diagnosis. Diagnosis was not meant to be a means of experiencing shame. When I used to work in a psychiatric hospital, it was very common for people to say, they would introduce themselves like, hey, I'm bipolar. Or other people like, hey, I'm depressed. And I would jump in with their permission, and I would ask them, hey, can I provide some perspective on that? So like, yeah, sure. Like, okay. I noticed you said it, you introduced yourself as, I'm bipolar, or I'm depressed. I would suggest changing it to, I have depression. The diagnosis does not label you. We are not labeled by one thing. We all have different hats. I'll use myself as an example. I'm a human being. I'm a son. I'm a partner. I'm a brother. I'm a worker, as an employee, right? I'm a friend. We all have different hats at different times, and sometimes at the same time. It's a very different matter when you think of, I am this compared to I have this. It's a very different mindset. Why do I say that with confidence? Because that's usually the feedback I get from people that I work with. They will say that, oh, that was such a difference. Like, yeah, it can be, right? Sometimes words have a lot of power. Another common concern that people express is that, oh, I'm concerned about having mental health symptoms. We all have symptoms. It's part of the human condition. If you're human, you're going to experience anxiety. I don't care who you are. If you're a human, you're going to experience sadness. Medically speaking, you can call it depression, even though depression, some people experience it more than other people. It's a spectrum like any other symptom, because it's a human condition. We all have different degrees of it. My level of anxiety, or my experience of anxiety, can be very different from yours, as well as sadness or depression. My energy level, in terms of how active I can be. Some people are more hyper, some people are more lower level. We're just different that way. Doesn't mean that we don't experience the same thing. We all experience it. We all experience a very similar stance. And what I mean to say by that is that you're never alone. I don't care what it is. You're never alone. If you're human, you're like what you've experienced. Rest assured, someone in the world has experienced the same thing. You're never alone, never. Another thing I commonly get is this normal? I'm not crazy, and I challenge people like, well, I don't like using the word normal because human condition, there's a spectrum of it. So, in different matters and different settings, different things can come up. I've never experienced PTSD. It doesn't mean that I don't have the potential to experience it. I think I'm not sure if it was Freud that once said a quote. that sometimes it's not the person who's depressed, but the environment. And that, I think, it also speaks a lot, right? It says a lot. So it's never just us, it's also the environment that can impact us. Sometimes that's the case. So when I hear the word normal, I suggest changing it to human condition. What is your struggle, so we can tackle it, right? Different struggles require different things, different approaches. The common metaphor we use is that a problem might I might be using a hammer to solve a problem, but the problem is not a nail, it's a screw, and I'm using the wrong tool. So we need to change it up. With all these examples that I've shared, my hope, again, is to encourage people to reach out, seek someone if you're in need. Don't stay with that want. Share it. Feel free. Also, don't ever try your best not to assume that you're going to be a burden. What I tell people with that is that I offer the following perspective. So when you say you don't want to be a burden, so basically you're taking the responsibility from the other person to let you know if it's inconvenient or not. Who are you to make that choice? The other person has will, just like you. Don't take that away from them. Let them tell you. Usually when it's loved ones, even if it can be a little direct or harsh, but they mean well, they'll let you know. And don't stop at the first person. Just like with therapists, I get people who have said, oh man, I've had a bad experience with former therapists, whatever the circumstance is. Because I have colleagues who would say, well, but there's this thing and that thing. Yeah, whatever. If I were to tell you, I've been praised by patients in the past. I've also been asked that they would like to switch up a therapist from my end. I don't take it personal because I'll give you an example. We have a saying in Mexico, and I'm American, by the way. I'm a citizen of the U.S., just in case you're wondering. I'll explain that more in another video. But in Mexico, we have a saying. I'll say it in Spanish, and I'll translate it as close as I can. In Spanish, the saying goes, no soy moneda de oro para caerle bien a todos, which translates closely to, I'm not a gold coin to be liked by everybody. Especially when it comes to being a service to someone, I'm not going to click with everybody. That's one of the biggest things to have a successful therapist with you, a therapeutic relationship to help you out. If it's not working out, I'll do my best. But if it's not working out, I encourage people, let me know and switch over, because it's at the service to you. What counts is still reach out for help. Reach out. Don't get concerned about hurting your therapist's feelings by declining their service and moving on. We can handle it. I promise you. The important is for you to reach out. I'll leave you with a quote that I like, stuck with me. From two of the most prominent neuroscientists that I've come across with. I had the fortune of meeting them in person, not like one-to-one, but in a conference. Heard them speak. I might butcher their names, so forgive me. The first one is Bessel van der Kolk, and the second one is Daniel Siegel. I'm kind of unifying their quotes, so they're not a direct quote, but it's kind of along their lines of what they convey, their philosophy. It goes, mental health problems can stem from several factors, including inability to manage emotions, lack of social connection. Speaking of the pandemic, it made it really challenging for that one particularly. And mental rigidity. We can be pretty stubborn people as human creatures. It's a part of our condition. It doesn't mean that we can't overcome them or work through them. Or difficulties with processing matters that come up in life. Yeah. Common one is that when people experience the loss of a loved one, especially through the pandemic, it's happened a lot. So when we're used to tackling challenges in life that we're used to, but when there's one that's a new one, sometimes our coping skills or the way we cope with them or manage them doesn't suffice. So that's also why that's one of the examples as to why I'm making this video, very impromptu again, to encourage you to seek out help or reach out for someone, loved one, a professional. Just reach out. Just because it's new to you, it doesn't mean that it's new for anybody else. Trust me when I say that you're not the first or last person or the only person in the world who's experienced this. And that's a good thing. You're special in some ways, but as long as you had a heartbeat and blood is running through your veins, you're not the only one, ever. I might be doing more videos, but I just wanted to share this one. Thank you for listening. I hope it helped you if you were uncertain about reaching out for help. And if you're still not sure, nothing wrong with, you can always, I was gonna say nothing wrong, but you can always just call a therapist. You get a vibe for them over the phone or something. They'll explain. We're used to that, man. Your questions is not the first time we've gotten them. It's a pattern. That's why I'm making this video. Stay safe, be well, and I wish you the best. Bye for now.